A very good evening, my dear students. A very good evening to you all. And let me just begin the link so that I can see if you all are chatting with me, communicating with me. All right, there we go. Yes. So, my dear students, I am Dr. Anaya Kulkarni, your Pedodontics guru with DBMCI. And from today, we are beginning with the live lectures of Pedodontics, the subject that can either scare you or you can be in love with the subject. And as you can tell, I am in love with this subject, and I will make sure that by the time our class is finished, by the time the entire session of Pedodontics finishes, you are going to fall in love with this subject too, right? Okay, so do we have people? Yes, we have around a good number of viewers to start the class, right? So just let me see where we are getting the comments. All right. Okay. So, my dear students, as I told you, the subject of pedodontics is a very unique subject. There is a saying in our pedodontic subject that children are not miniature adults. You cannot say that a treatment that is being done in the adults, it is similarly done in the children. It's just that you need miniature instruments or you have miniature morphology of the same thing that is present in the adults. So basically, the children are not miniature adults. They are an individual on their own, and the entire thing is different. And the most challenging part of pedodontics is the management of the behavior, and that is why everybody is scared of a child patient. I remember there was a student who used to tell me that when I sit in my clinic and there is a lady and a child entering into my clinic, I pray to God that the patient should be the lady and not the child, because it becomes very difficult. You know the theory, you know the practical, you have a great clinical hand. But what is the most uncertain about the subject of pedodontics is the management of the behavior. You just cannot say how the child is going to react to your treatment, and hence you need to read about child psychology, because when you know about child psychology, you will know about how to manage the child's behavior, and that is the thing on which your treatment outcome is going to depend upon. That is why every time I take the pedodontics lectures, I begin it with my favorite topic and the most important part of pedodontics, that is child psychology. All right, so without further ado, let me begin with child psychology here. Okay. Yes. So, what is child psychology? Basically, we are going to read about child psychology under the following contents. So it is going to be read under, I'm going to tell you a little introduction about child psychology. Then we are going to read a little bit of history of child psychology. Then some important definitions we are going to go through. Then what is the importance, what are the late and early perspectives of psychology. Then the main part we are going to come to, and that is the classification of theories of child psychology. That's the most important part. That's where the most of the MCQs of these part comes from. So this part is going to help you with your theoretical descriptive exams. This is where most of the MCQs come from. That is the classification of the theories of child psychology. And once we read about the classification of the theories, we are going to read one by one about every theory of child psychology in detail, in a very fun, in a very example oriented manner. So all those people who have already done this, that have begun with child psychology, take my word, you are going to love how we read about the theories. All right. So to begin with, a better understanding of child psychological development helps us to understand the child better and to deal with him more effectively. You can detect deviations from regular patterns of behavior. So because you are able to see so many children and because you've read child psychology, you can make out what is deviation from a regular pattern of behavior and what can actually interfere with the treatment process. And a lot of times you can actually detect small behavioral problems such as mild autism, mild ADHD, etc. You can actually diagnose, or you can actually be sure of these particular things. So that is how it helps. Now earlier, what used to happen in earlier civilizations, basically they attributed the cause of madness to magic or divine forces. If a little child is behaving in a very wacky or in a very different manner, they used to say that there is a particular degree of madness in this particular child, and it is because of some divine force, some jadoo, some magic. Okay, so the treatment was mostly done by the priests. There was no sign of psychologists that was present in that time. But later there came the introduction of asylums, that is mental hospital, etc. And after a lot of such ill practices, such hit and trial methods, finally in the 20th century, so in the 20th century came the hero of child psychology, who was Sir Sigmund Freud. So Sir Sigmund Freud basically was came to be known as the founder of modern psychiatry. So whenever you get such a question, Sir Sigmund Freud is the founder of modern psychiatry. Okay, so Sir Sigmund Freud is the hero there. Okay, now you all know why is psychology important. Basically, to understand the psyche, to understand the behavior of the child. Now, what are the definitions that you all need to know? So, you need to know the definition of psychology. So, what is psychology? Psychology is a science of human mind and behavior. Okay, what is psychology? Psychology is the science of human mind and behavior. So it is the science of human mind and behavior. Now, when it comes to the study and application of a child's mind, that means when it becomes a science or study of a child's mind and how it functions, then it becomes child psychology. So what is child psychology? It is the science or study of child's mind and how it functions. Right, so that is child psychology. Now, when you read about psychology, you basically read about two things. Okay, so whenever we are going to read about psychology, we are reading about primarily two things. That is, one is emotion and one is behavior. So the entire topic is broadly divided into these two things. Now, what is emotion? Emotion is an all-around state of an organism marked by increased bodily activity and strong feelings directed to some subject. That is emotion. This definition was given by Kimball Young. Okay, now these emotions are basically divided into two types of emotions. Very easy. What are the two types of emotions? The two types of emotions are positive emotions so there are positive emotions and there are negative emotions. Okay, so we have positive and negative emotions. When I say positive emotions, that means we are talking about affection, amusement, joy, curiosity, and happiness. These are the positive emotions. Okay, so what are those? They are affection, amusement, joy, curiosity, and happiness. These are the positive emotions, and the positive emotions are essential for a normal development of an individual. Then we have negative emotions like fear, anger, and jealousy. Alright, so we have fear, anger, and jealousy, and these emotions are harmful for the development of a particular child. Right, so we do not need to right now study in depth about the positive emotions, because a person who is feeling positive is not our topic of interest. We are very happy to have a person with positive emotions, though what we need to read about are the negative emotions, because that is where we need to show our management skills. That is where we need to do the behavior management, and that is why we need to read about the negative emotions. Okay, now the emotion, as I told you, are again divided into fear, anger, jealousy, cry, and anxiety. Okay, why I wrote cry and anxiety differently are they are somewhere related to positive and negative emotions both, but since they have a part of negative emotions, we will read about it. So we are going to read in detail about fear, anger, cry, and anxiety one by one. Right, the first thing, the most important thing, the most MCQ oriented thing that you need to read about is the cry. Okay, so let us take up the cry. Okay, so now cry is basically of four types. Okay, so there are four types of cry, and this was established by Elsbach in the year 1963. That is when this person called as Elsbach actually told that there are these many different types of cry, and he defined them. So who did it? It was done by Elsbach in 1963. Okay, so the cry is of four types, as I told you. What are the four types of cry? It is obstinate cry. There is a frightened cry. Then we have a hurt cry. And then there is a compensatory cry. Okay, so let me show you a picture. Okay, this is the first type of cry, that is called as the obstinate cry. So what exactly is an obstinate cry? So what you need to know is there are certain key features, there are certain keywords to every type of cry, and these keywords are what are given in the MCQs. Okay, so you need to catch those keywords in order to identify what type of cry they are asking in the MCQs. Okay, so an obstinate cry is when the child throws a temper tantrum during or throughout the dental treatment. So the first keyword is temper tantrum. Okay, so the first keyword is temper tantrum. What is temper tantrum? Temper tantrum is when a child is crying loudly, he is acting very stubborn, he does not want to listen to you, he's throwing his hands and legs in the air, he's stomping his feet, he's throwing his hands in the air. That's called as a temper tantrum. That means he's being stubborn. He's just, I mean, this particular picture is so self-explanatory. You would have seen n number of children doing this. The child wants a chocolate, you don't get a chocolate, This is how the child is going to look. Okay, so this is called as an obstinate cry when the child is throwing a temper tantrum. The second keyword to an obstinate cry is this type of cry is loud, it is high pitched, and it is paused and repeated over and over again. So the child is going to yell, he's going to cry, and then probably he gets tired, so he pauses, like he does this, and then he cries again loudly. Okay, so that's called as a pause and repetition of the cry. Okay, that's again a key word for the obstinate cry. So there is pause and repetition. Right? Again, the most important keyword for an obstinate cry is it is characterized by a siren-like wail. Okay, siren-like wail. So what is a wail? Wail means a loud cry. That's also called as a wail. Siren-like means the cry is so loud you'll almost go like this. Okay, it's like a siren. It's continuous, loud, high pitched. It's as if somebody has blown a continuous siren. And wail means a loud cry. Okay, so obstinate cry is characterized by a siren-like wail. So now whenever you get a question that says which type of cry is characterized by a siren-like wail, you straight away look for the obstinate cry, right? Okay, so that's generally a child's external response to the anxiety. He's scared. He's scared of all the instruments. He's scared of, okay, so he's scared of the instruments, he's scared of the machines, he's scared of the noise, he's scared of the smell, he's just generally scared of you. So that's a child's response to anxiety. What is it? Child's external response to anxiety. Okay, just let me check if I have any doubts there. Anybody asking me anything? Okay. Okay. Right. Okay. Yeah, so it is generally a child's external response to anxiety. The second type of cry is a frightened cry. So this is how a frightened cry looks. Okay, it is again the keywords. Let us catch the keywords. The keywords are it is characterized by torrent of tears. Okay, so characterized by torrent of tears. The second, what is torrent of tears? Torrent of tears means a flooding of tears. There are a lot of tears coming out. Look at the picture. The child is like weeping. Okay, so there is torrent of tears. Second is there are convulsive breath catching sobs. Okay, so the frightened cry is characterized by convulsive just give me a minute. Convulsive breath catching sobs. So what are convulsive breath catching sobs? Convulsive breath catching sobs means doing like this, like that, like breath catching. They are convulsive. The child is almost like convulsing, he's shaking, and there are breath catching sobs. So it is characterized by that. Usually the child emitting this type of cry has been overwhelmed by the situation. That means he's actually overwhelmed and scared of the situation. He is imagining all sorts of hurtful experiences. So he is generally overwhelmed by the situation. Okay. So what is frightened cry? Frightened cry is basically where the child is overwhelmed by the situation. There are torrent of tears and breath catching sobs. These are the keywords. The next type of cry is the hurt cry. Okay, so that's the hurt cry. So what happens in the hurt cry? It may be loud and more frequent. Okay, such a cry may be loud and more frequent. So it is loud and more frequent. Now, a hurt cry is different from an obstinate cry. How? Because a hurt cry generally occurs when the child genuinely has pain. Like the child is sitting very confident that, okay, this fellow is doing something nice to my teeth, and then suddenly you poke into the pulp, or probably, there is something that causes pain to the child, and then he just lets out a loud cry. That's a hurt cry. It is frequently accompanied by a small whimper. Whimper means that kind of a sound, that is whimper. So it is accompanied by a small whimper. Okay, now there is one particular characteristic of this type of a cry in which initially a child in discomfort shows a single tear filling the corner of the eye. So the child is sitting, but he is uncomfortable, and there is a single tear filling the corner of the eye. And as soon as the child experiences pain, it flows down, it is followed by a lot of tears, and the child starts weeping, the child starts crying. All right. Okay, so the next one is, yes. So these are the, okay, now we have the compensatory cry. I do not have a picture of the compensatory cry. Why don't I have a picture of the compensatory cry? I will tell you. So compensatory cry, the one striking feature of compensatory cry that is generally usually given in the MCQs is that it is not a cry. Compensatory cry is not a cry at all. Okay, they will give you in the MCQ which of the following cries is generally not a cry. Okay, so not a cry at all. That is a compensatory cry. Why is it not a cry at all? Because it is a sound that the child makes to drown the noise. For example, a drill. So the child is very scared of your erotor voice, and in order to, he knows that it's not going to pain. You've explained there is going to be no pain, etc. But he's scared of the voice of the drill. This scared of the noise of the erotor. So he does this. Like that. He will just keep on making a continuous monotonous voice. So he'll keep on going. That is, the cry is a slow monotone. And what is the reason for it? That he tries to drown the noise of the drill. He tries to drown the noise of the compressor that is coming. These all noises are scaring him. So he's just going on making a continuous slow monotone in order to distract himself from the scary voices. Okay, so it's sort of a coping mechanism to the unpleasant auditory stimuli. What is it? It is type of a coping mechanism. Okay, so it is a sort of a coping mechanism. Right? Okay, I can just see your messages. I'm so sorry. I just missed. Somebody asked me to explain the siren-like wail there. Good evening to all of y'all, all of my beautiful students. I just saw your messages. Good evening, good evening. And somebody asked me to explain the siren-like wail. And now you all can message me. Please, I can see all your messages now. So siren-like wail, when I say siren, siren means a siren. I made a sound also. Were you not there? So siren-like wail is like, somebody has just played a siren. It's very shrill, loud and continuous. That is like a siren. You've heard a siren play, right? So siren, and wail means a continuous cry. That's a siren like wail. I hope you understood. SSJ, super SSJ, you just messaged me to explain the siren like wail. That's a siren like wail. I hope you understood. Please tell me if you understood. Okay. So back to compensatory cry. Compensatory cry is not a cry at all. It is just a coping mechanism to drown the unpleasant auditory stimuli. right? Okay, so there we finish with the cry. The next emotion that we are going to deal with is good evening. Okay, so that is the next one is anger. So let's write anger in red color. Okay, so what is anger? Anger is the outburst of the emotion that is caused by the child's lack of skill of handling the situation. That means the child is not able to handle the situation. He just does not want to exist in your clinic. But he has parents, he has a dentist standing right there who wants to do the treatment. So the situation is not under his control. So how is he going to, express that particular helplessness? By the outburst of an emotion called as anger. He's going to get angry. Infants and young children respond in anger in a direct and primitive manner just by crying loudly. Okay, when a child is around 15 months of age, he expresses the anger by throwing objects. 15 months, that means around 1.5 years. Okay, so he will express anger by throwing objects, throwing his hands, stomping his legs, etc. A 2-year-old will probably, attack somebody with an intention to hurt. Like a 2-year-old, you try to hold a 2-year-old, he'll probably, give you a punch or probably do something like. So he will attack other children or probably an adult in order to hurt back. A 4-year-old will express anger through begging, probably, please don't do it. So these are the different ways of expressing anger in different types of children. Again, a 6-year-old will probably have a renewal of violent methods to express their anger, like, letting out all the bad words they can say, like, you are a very bad man and something like that. So there are different ways of children in different ages to express their angers, and my god, how you all must be expressing your angers. You all know all the bad words, you all know all the things, you are full of attitude and everything. So with every age you develop a different type of anger. Okay, so that's anger, just the outburst of emotions when a particular person is unable to handle the current situation, that is anger. Okay, the next emotion that we are going to read is the fear. Very important, very MCQ oriented. So fear, right? So what is fear? Fear is an unpleasant emotional state consisting of psychological and psychophysiological responses to a real external threat or danger, including agitation, alertness, tension, and mobilization of alarmed reaction. Okay, it is defined, a very small definition of fear is, it is defined as a painful feeling of impending danger, evil, trouble, etc. Okay, so that is fear. It is actually a reaction to a known danger, the best definition. Okay, so there is this person saying, I just go silent when yeah, exactly. Somebody can go silent when they are angry. Somebody can just blurt out all the bad things. Somebody will just cry. There are different methods. Okay, so back to fear. One very important definition of fear that distinguishes it from anxiety is that fear is a reaction to a known danger. How does it differentiate it from anxiety? Because anxiety and fear are used synonymously. When you are anxious, you are also scared. Okay, fear also means being scared. So what is the difference there? Fear is a reaction to a known danger, and anxiety is a reaction to an unknown danger. Okay, so when we say anxiety, it is basically, I am going to though cover it later, but just let me tell you, okay, because I'm going to quote a very good example for this. So anxiety is a reaction to an unknown danger. Okay, so how can you differentiate between the two? So fear, for example, you will, if you are asked to go to a very dark place, a very broken haveli, or a place where ghosts exist. Okay, ghosts exist. Okay, so if somebody tells you at 3 a.m. in the night you're supposed to go in that dark haunted place, what you will feel is fear, because you're so convinced ghosts are going to be there. Or for example, there is a very fierce dog who's already growling at you with sharp teeth and everything, and somebody asks you go stand near him and just pat him. You are not going to go. What you will feel is fear. That is a reaction to a known danger. Or probably a dog is running behind you. What you feel is fear, because that is a feeling or reaction to a known danger. Whereas anxiety is a reaction to an unknown danger. For example, you are roll number 3 and you are sitting for a viva, and roll number 1 is inside in front of the externals giving the viva. What you feel is anxiety. You do not know how the external is, whether he's sweet, whether he's come to just grind you. That time what you feel is an anxiety, because that's a reaction to an unknown danger. Okay. So I hope you understood what is the difference between anxiety and this thing. Okay. So I hope you understood what is the difference between anxiety and fear. Fear is a reaction to a known danger. Anxiety is a reaction to an unknown danger. Okay. Now what we need to read about in fear is mainly the types of fear. Okay. So what are the types of fear? Types of fear. So there are different types of fear. That is basically 3 types. The first is innate fear. Okay, the first type of fear is innate fear. The second type of fear is objective fear. And the third type is subjective fear. Okay, so the third type is subjective fear, right? So what is the difference between these 3? This is a very MCQ oriented part that I'm covering now. What is innate fear? Innate starts with the word in. Okay, innate starts with the word in. That means a fear that is inbuilt, a fear that is present by birth, that does not need an experience to develop. Okay, so that is inbuilt, a fear that is inbuilt, a fear that is present from birth. Okay, for example, fear of darkness, like a child who is very young, say a child like who is 5 months or 6 months old, and if the room becomes very dark, the child is going to cry. That is, he has a fear of darkness. The fear of sudden sounds. Okay, like even now you might get startled of a sudden sound. A child also gets startled of a sudden sound. These fears are inbuilt. These fears come from birth. You do not need an exposure or an experience for this fear to develop. So this is an innate fear. That means a fear that is inbuilt or present by birth. Then comes an objective fear. What is an objective fear? An objective fear is a fear that develops when you have a previous experience of a particular thing. That means that is when you have an exposure to a stimuli or previous experience. Okay, for example, objective fear, that means you went to a dental clinic, and probably the first thing that the dentist did was give you an LA, give you a local anesthesia and pull out your tooth, and it was a very painful experience, and now you are scared of all the dentists in this world. Okay, so now you've developed an objective fear towards dentists. Or for example, you used to love, for example, dogs. A lot of us love dogs as a child, for example. But once when you were patting a dog, the dog barked at you and you got really scared. So now you've developed an objective fear towards dogs. So a fear that develops because of a previous bad experience is called as objective. One example again, if there is a hot utensil kept, you keep on telling a child, don't touch that utensil, But the child is very curious. He feels that I think there is something really good in that utensil. I'll go and touch it. He touches the utensil and the hand gets burnt. Okay, so now he's developed an objective fear towards utensils that are kept around the gas stove. So that's objective fear that is developing due to a previous experience. Then we have subjective. Then we have a subjective fear. What is subjective? So how do you remember? Subjective starts with the word S. So subjective fear is something that is suggested by others. Suggested by others. Okay, like for example, you have no dushmani, you have no enmity with the dentist. You think they are good big people, good nice people. But since you were a child, your mother has been telling you, don't eat chocolates. If you eat chocolates, I'm going to take you to the dentist. And what will the dentist do? Dentist is going to pull your teeth, pull out your tooth, or he's going to give you an injection. Now you have it in your mind that the only thing a dentist does is give injections. So so you have no previous bad experience, but because your mother or your father has been telling you that a dentist is going to give you an injection, you are scared of a dentist because that fear has been suggested by others. Okay, I get so many patients who are like, if I tell them that this tooth is decayed and you need to get a root canal done for this tooth, there are so many patients who will tell me that, oh, root canal, but I've heard that once you get a root canal done, your tooth will keep paining again and again. So ma'am, is that true? Will my tooth keep paining again and again because of a root canal? So what is that? That is a subjective fear, a fear that has been suggested by others and has no previous experience associated by it. Okay, I hope it is clear, the three types of fears to you: innate, objective and subjective fears. Innate you can remember by the word in, and subjective you can remember by the word S, that is suggested by others. Okay. Okay. I hope you people are not getting bored so far. I hope I am being clear with what we have read so far. Okay. So again, anxiety, as I told you, anxiety is nothing but anxiety. Anxiety is a type of fear to unknown danger. So it is often defined as a state of unpleasant feeling combined with an associated feeling of impending doom or danger from within rather than from outside. Okay, it is a state of uneasiness or tension. Okay, so there are two types of anxieties. Very quickly I'll cover. Okay, all right, so there are two types of anxieties. There is a trait anxiety and there is a state anxiety. Alright, so what is a trait anxiety? Trait anxiety is a lifelong pattern of anxiety as a temperament feature. Okay, that means something that is inbuilt in your character, that is trait anxiety. Okay, okay, these children are generally jittery, skittish and hypersensitive to stimuli. Children who are very, all the time they are scared and very jittery, that is trait anxiety. Trait means in the character, something that is inbuilt in the character. These people will be scared in all the situations. And state anxiety, what is state anxiety? It is seen only in particular situations. Okay, like for example, if a child has trait anxiety, he will be scared of everything. A teacher has asked a question in the class, so he will be like, oh my god, she should not ask me the answer, she should, because I'm very scared of standing up and answering. Okay, that is trait anxiety. He is scared in all he's anxious in all the situations. And state anxiety particularly is in a particular situation, like that particular child will be scared only when he goes up on the stage in front of hundreds of people. That time he will feel anxious. That is state anxiety. Trait means character, that is inbuilt, and state, that means it is situational, in a particular situation only. Okay, correct. Okay, interesting. Thank you so much, Nikhil. Right. All right. Okay, so that was about the negative emotions. Now there is one particular thing that I will tell you before we start with the theories of child psychology. And what is that particular thing? That is the pedodontic triangle. Right? So pedodontic triangle, the people who frame questions, they love the pedodontic triangle. Okay, So we have the pedodontic triangle. Right. What is pedodontic triangle? So, basically, why they developed a pedodontic triangle was they said to have a successful dental treatment, there is interdependency of, or you need a cooperation of three things. That is, you need the cooperation of the child as well as the family or the parents, particularly the mother and the dentist. So they came up with a triangle that looked something like this. So this is a triangle. In the triangle, they put two-way arrows. I'll tell you why. So in the pedodontic triangle, there are arrows like this. Okay. And how did they place? So on the apex of the triangle, they placed the child. It is at the top of the triangle. This is called as the apex. You know, right? The triangle apex is on the apex. They place the child. Here they place the family or the parents, and very particularly the mother, because it is believed that a behavior of the child is influenced very greatly by the behavior of the mother, very particularly. And the third aspect they said was the dentist. All right, and his environment also, the environment of the dental clinic also. So why they put two-way arrows is because the child should understand the dentist and the dentist should understand the child. The dentist should be able to convince the family and the family should be able to cooperate with the dentist. A child should be able to listen to the family and the family should be able to console, to explain, to back up the child. So there is interdependency of all these three factors on each other, and when there is cooperation and coordination of all of these three with each other, only then comes out a successful dental treatment as a pedodontist. Hence they said this is the pedodontic triangle. So this particular pedodontic triangle was given by Mr. Gerald Z. Wright in the year 1975. So Gerald Z. Wright gave this pedodontic triangle in the year 1975. Now, Mr. McDonald came later in the year 2004 and modified this pedodontic triangle. How did he do that? So, who was he? Mr. McDonald. McDonald in the year 2004 did what? He said that, all right, the three things are important. So the same triangle like that, child, family, and dentist. There is an interdependency, but what he modified in this triangle is that there is one more aspect that plays a very important role, and that is the society. So he added the society in between, because apparently the society affects the child as well as the family as well as the dentist. So he said that society is the fourth wheel, society is the fourth aspect that influences the mentality of the child, the family and the dentist, and also plays an important role in the outcome of the treatment. So here you have both the original pedodontic triangle and the modified pedodontic triangle, right? Okay, now let us begin with the theories of child psychology. Okay, so far are we feeling very interested in the subject, or are we already bored of the subject? Okay, So when we read the theories of child psychology, we read the first thing is, okay, interesting, right? Thank you so much. Okay. So when we read about the theories of child psychology, the first thing we read about is the classification. What are the various types of the theories of child psychology? Okay, so a broad classification is theories depending upon these stages. Okay, and then the theories according to the learning pattern. Right, so theories depending upon these stages, we have two types, that is the stage theories and the non-stage theories. Okay, in the stage theories we have three theories, that is the psychoanalytic theory. Okay, there's a psychoanalytic theory, there is a psychosocial theory, and then we have a cognitive theory. That means the theories that we read in stages, like first when the person is a child, then when the person becomes a toddler, then the a young adult, and then an adult. So when we read it in the stages, it is called as a stage theory. And then we have non-stage theories, that is just one theory, which is the social learning theory. Okay, then we have according to the learning pattern. So they are also called as the learning theories. What are the or theories of learning? What are the theories of learning? It is, first one is classical conditioning. Okay, then we have the operant conditioning. Then we have the hierarchy of needs. Then there is a social learning theory again, which is a non-stage theory as well as a learning theory, theory of learning. Okay, so we are going to cover these theories in details. There is one more classification that I just want to quickly tell you. So the other classification goes something like this. The first type of theories are the psychodynamic theories. I'm just going to orally tell you what are the psychodynamic theories. Just make a note quickly. So the psychodynamic theories are the psychosexual theory, psychosocial theory. So psychosexual theory given by Sigmund Freud, psychosocial theory given by Erik Erikson, and cognitive theory by Jean Piaget. These three are the psychodynamic theories. Then the second type of theories are the theories of learning. Theories of learning and development of behavior. These are the hierarchy of needs by Maslow, social learning theory by Bandura, by classical conditioning theory by Ivan Pavlov, and operant conditioning theory by Skinner. And then the third type of theory is just one, which is Margaret Mahler's theory of development. Right, so these are the three types of theories. Now one by one we are going to cover each theory. Very interesting, you're going to love the theories. Okay, so to begin with, we are going to begin with the Sigmund Freud's theory. I don't think I have a picture to this, do I? Okay, So the first theory is the okay, just let's begin with who was Sigmund Freud. So as I told you, he was the father of modern psychiatry. Okay, he was the founder of psychoanalysis, a clinical method for treating the psychopathology. He was an Austrian neurologist, Sigmund Freud. Okay, so he gave the first theory, the most accepted, the most beautiful theory, that is the psychoanalytic theory, also called as the psychosocial theory, which was given by Sigmund Freud in 1905. So that's the first theory that we are going to cover. Okay, so what is it? It's called as the psychoanalytic or psychosexual theory. Who gave it? It was given by Sir Sigmund Freud. Okay, in the year 1905. Okay, so it was given in the year 1905. Now, what did basically Freud say? Freud said that according to Freud, what humans do, why they do it, what and how humans are largely determined during the first few years of life, during which the person develops characteristic ways of dealing with internal drives and conflicts. The differences in personality originate from difference in childhood experiences, such as childhood sexual experiences. Now, basically, let me simplify this for you. What he said is, all the feelings of pleasure, all the feelings of being deprived, basically develops when a person is an infant. That is what Sigmund Freud said. So what happens to the child, what experiences are there of an infant, basically develops the future behavior of the child, develops the characteristic way of how the child is going to deal with the different situations in life. So he stressed a lot on the child right from the birth, what characteristics develop right from the birth. So in order to explain these, complicated psychoanalytical things, what he did, he gave three things. What three things Sigmund Freud gave? That's why it's called as psychoanalytic, because what he did, he analyzed the psychology and he stressed on the sexual experiences right from the birth of the child. Psychoanalytic or psychosexual, right? So what three main things did Mr. Sigmund Freud give? He gave first thing a topographic model. Okay, which is also called as the iceberg phenomena. Please let me know if there is anything that I need to repeat again for explaining. Okay. Right. So first thing he gave is the topographic model. The second thing he gave was the psychic triad. Okay, and the third thing that he gave was the stages of psychosexual development. Okay, so these three things he gave. So let us take things one by one. The first thing that I'm going to explain you is the topographic model or the iceberg phenomena. This is the first thing that I'm explaining. Now, for example, you all have seen Titanic, right? All of you all must have seen. So you all know, okay, whether or not you've seen it, you still know what is an iceberg, right? Iceberg is what? It is a mountain of ice that is floating onto large water bodies, on large water bodies. That's an iceberg. Okay. So an iceberg is something like this actually. You want me to repeat the classification? All right. Just 1 minute. Where did I write the classification? Yes. So this is basically one classification. The second classification is this. So do you want me to repeat it, or do you want me or because you will find what theories are present in these under these heads in any textbook. That's why I did not write it down so that I can save time. Okay, so this is the broad classification. You have the various theories under this. So do you want me to write them down? So I'll write them down if you want me to write them down. Otherwise, I think you'll find it in any standard textbook. Okay, I've just written down the headings of the classification. This classification you are not going to find in general textbook, so I wrote this down. You can take a screenshot or write this down. This one you're going to find in textbooks, the red one. Okay, just please quickly tell me. So that I can come back to my iceberg. I love the iceberg phenomena, by the way. Very interesting. Okay, I think there's a little delay with the YouTube, this thing. Yeah, all right. So I'll proceed. Good. So what is the iceberg? So the iceberg is something like this. Great. All right. So what you saw in the Titanic, okay, just a second. So what you saw in the Titanic was only this much part of the iceberg. So basically icebergs are huge mountains of ice floating on water, but what you can see floating on water is just the 30% of the ice or the mountain of the ice that is floating. There is 70% of it that is below the water level. Okay, so the 30% of it is present above the water level. There is around 40% of it that we can say is present underwater. Okay, so let's take a beautiful orange color. So we have this part that is the middle part of it, that is around 40% that is present here, and then we have again some 30% of it that is present deep down that nobody can reach, that nobody can see. So the iceberg is divided into three parts: the superficial part that is visible, the part that is present under the water but you can still reach it, and then there is a part that is present so deep down in the water that you cannot reach it. Okay, now how did Sigmund Freud associate an iceberg with the human mind? What he said was the 30% of the iceberg that is visible outside the water is basically it's like the conscious mind. Okay, the part of the iceberg that is present below the water in the middle is like a pre-conscious mind. And then the part of the iceberg that is present very deep inside the water where you cannot reach is basically the unconscious mind. All right. Now, what is conscious mind? Conscious mind are the current thoughts and perceptions that you have. Okay. So, what is conscious mind? These are the thoughts and perceptions. Like, for example, right now you must be thinking about an iceberg. Some must be thinking about how Sigmund Freud looks. Some must be thinking about who was Sigmund Freud's wife. And some must be thinking about probably Titanic. Okay, so these are the current thoughts and perceptions that are going around in your mind, because they are all related to the topic we are talking about right now. So the current thoughts and perceptions are called as the conscious mind. It was compared to the part of the iceberg that is visible above water. What is preconscious mind? Preconscious mind are the memories or the stored knowledge. Both the social learning theories are the same, my dear. They come in both the parts. They come in the non-stage theories also, and they come in the learning theories also. Okay, so the preconscious mind contains the memories and the stored knowledge. Now, example, like for example, you all have childhood memories, okay? You all, probably somebody would have met with a minor accident in the childhood, or probably somebody would have had a very bad fight with a very close friend when they were a child. So you do not keep thinking about these things all the time. They are not your current thoughts and perceptions, but they are somewhere deep down inside, not very deep down, but they are in your mind, they are stored in your knowledge. The moment somebody talks about it, hey, you remember when you were in class 3 and a motorcycle had hit you and you fractured your leg or something like that. So you can remember it, you can bring back that memory. Okay, it's like handy memory, you can bring it back. Okay, so that's the preconscious mind. Right, so these are the memories and the stored knowledge. You are not thinking about what is 3 8s are right now, but if somebody asks you what is 3 8s are, or so you'll say 24. Okay, so that's stored knowledge, you can bring it back. You're not thinking about it right now, but you can bring it back. So the stored knowledge or memories was compared to the middle part of the iceberg that is reachable. You can go to it, reach it. But there is a part of the iceberg that is very deep down, that is unreachable, that is unconscious mind, that contains the fears, the violent motives, the selfish needs, and the irrational wishes. Okay, so this is like, a part of the mind that exists, but you cannot go back to it all the time. You should not go back to it all the time, because say it or not, it's a human mind. We've all had good and bad thoughts at some stages of life. You all felt like, stealing something from somebody. You all felt like hitting somebody. You all had these violent motives, some irrational wishes. Probably somebody had feelings for someone they should not have feelings for. And these all things existed in everybody's life. But because we are sane people, because we are in our right set of mind, we decide to bury those feelings in a part of the mind that they become irretrievable. So that is the unconscious part of the mind, that is deep down unreachable part of the mind, that was compared to the deepest part of the iceberg. Okay, so basically Sigmund Freud compared the human mind to the iceberg like this. There is a conscious mind that is readily available, going on presently. There is a preconscious mind that is stored, retrievable, and there is an unconscious mind that is irretrievable, that is deep down inside. Alright, so this is the topographic model. Are we clear with the topographic model? Do you all want me to explain anything again in the topographic model? Thank you, Disha. Right. So that was the, please repeat in short. What is English? You want me to explain it to you in Hindi? Dr. Ashish? So basically Sigmund Freud compared the human mind, fast I'm going to explain it, any percentage, no. No percentage, Kirti, as such given, but roughly they say 30% of the mind or the iceberg is visible or currently present. A 40% is the middle part and a 30% is the deep down part. But that's totally hypothetical. You cannot give a definite percentage to these. Okay. Okay, Dr. Ashish, I'm going to very quickly explain to this in Hindi. Okay. So basically कुछ नहीं है. The human mind has been compared to an iceberg. Iceberg का मतलब तो I hope आपको पता है क्या होता है ना. तो iceberg का 30% part जो है it is present on the water, okay, which is compared to the conscious mind. जो आप अभी सोच रहे हो that is your conscious mind. आप जो भी अभी सोच रहे हो वो conscious mind है. आप उसके बारे में वो अभी आपके दिमाग में घूम रहा है ना. ओके, यस, इंग्लिश, राइट. ओके, तो वो अभी आपके माइंड में घूम रहा है. दैट इज योर कॉन्शियस माइंड, जो आप अभी सोच रहे हो. प्री कॉन्शियस माइंड मतलब जो आपके साथ हो चुका है, जो आपके माइंड में स्टोर्ड है, जिसके बारे में आप अभी नहीं सोच रहे, लेकिन अगर उसके बारे में आपको कुछ पूछा जाएगा तो आप उस चीज के बारे में डिस्कशन कर सकते हैं. जैसे किसी ने आपको पूछा कि अरे वो जब बहुत छोटे थे तो आपका एक एक्सीडेंट हुआ था, उस टाइम पे क्या हुआ था, तो आप उसके बारे में अभी नहीं सोच रहे थे, लेकिन वो टॉपिक निकला तो यू कैन रिट्रीव योर मेमोरीज. आप उन मेमोरीज को पकड़ के लेके आ सकते हो, आप उसके बारे में डिस्कस कर सकते हो. वो हुआ आपका प्री कॉन्शियस माइंड. ठीक है, जो आपके दिमाग में स्टोर्ड है लेकिन आप उसके बारे में हर वक्त नहीं सोचते रहते हो. एंड देन फिर अपना होता है एक अनकॉन्शियस माइंड. अनकॉन्शियस माइंड मतलब ऐसी कुछ चीजें जो अपन ने कभी फील करी होंगी, लेकिन एक सेन माइंड के लिए, एक नॉर्मल माइंड के लिए उस चीज पर एक्टिविटी करना नॉर्मल नहीं होगा. किसी टाइप का वायलेंट कोई मोटिव, होता है ना, कभी कोई ब्रेकअप हुआ हो तो आपने सोचा होगा मैं बताता हूँ इसको, इस टाइप से कुछ, है ना. ऐसा कोई वायलेंट मोटिव जो आप नहीं करोगे बिकॉज यू आर सेन, बट यू आर ह्यूमन, यू माइट हैव थॉट अबाउट इट. तो आप ऐसी चीजों को कैसे एक अनकॉन्शियस माइंड में बरी कर देते हो. कभी ये दिमाग में आया होगा पर आप ऐसे नहीं कर सकते. दैट्स द अनकॉन्शियस माइंड. कोई डर रहे होंगे, जैसे कि ना आपके घर में कोई है जिससे आपको बहुत डर लगता होगा बचपन में, है ना, पर आप वो चीज बोल नहीं सकते हो. यू कैन नॉट ब्रिंग इट आउट. सो दिस टाइप ऑफ थिंग्स दैट यू बरी इन एन अनकॉन्शियस माइंड, दैट्स द अनकॉन्शियस पार्ट, दैट्स द डीप डाउन आइसबर्ग वाला पार्ट. ठीक है, अभी समझ में आया आशीष? हाउ इज द ह्यूमन माइंड बीइंग कंपेयर्ड टू द आइसबर्ग? क्या मेरी इंग्लिश ठीक थी? अभी ठीक थी तो आई एम गोइंग टू मूव ऑन विद द साइकिक ट्रायड. दैट्स अगेन वेरी इंटरेस्टिंग. ऑल राइट आशीष, ठीक है ना. तो लेट्स स्टार्ट विद द साइकिक ट्रायड. अब साइकिक ट्रायड क्या था? साइकिक ट्रायड दैट मीन्स समथिंग दैट हैज three things, that is a group of three things. So what was the triad he gave? Okay, thank you so much Poonam. Right, so the triad included three things, that is ID, ego and superego. Okay, so there were three things in the triad. Now what is this? Now, and I want you all to understand very very carefully. Very interesting phenomena this is. Okay, this is going to stay with you throughout your life, so just understand very nicely. So first I am going to explain it to you so that you understand what is the meaning of these three things, and then we are going to read the theory of this, the MCQ related. Just understand what is ID, ego and superego. ठीक है. Now ID, ego and superego is a state of mind. Okay, it develops at various ages, and right now we have all of these three in our mind. There is one of these three that is predominant. अच्छा ठीक है, I am going to explain it to you in English sometimes, but there are some people who don't know, who are not comfortable with Hindi. That's why मैंने आई एक्सप्लेन इन इंग्लिश. बट कोई फंडा अगर इंग्लिश में समझना हो तो अलग से मेंशन कर देना, समझा दूंगी. ठीक है, अभी सुनो. ठीक है, अब कैसा होता है? व्हाट इज आईडी? आईडी इज बेसिकली गवर्न्ड बाय प्लेजर प्रिंसिपल. आईडी इज द स्टेट ऑफ माइंड ऑफ एन इन्फेंट. A 2-month-old baby has only ID in the mind. ID is the most primitive brain that is present, the most youngest brain that is present. So a 2-month-old will have only ID in the brain. What is ID? ID is something that is governed by pleasure principle. Now, what is pleasure principle? That means ID is only concerned with pleasure. ID is only concerned with whether it is getting satisfied or not. Like if you have a 2-month-old child around, whenever the child feels hungry, what does the child do? The child starts crying frantically. The child is crying beyond bounds. Okay, he's just crying. Does he think ki probably my mother is not around? Probably the milk, probably she'll take some time to fill the bottle or make the formula milk for me, or something like that. Does he understand the conditions that can be applied? No. What he wants, he just wants to be fed. He just wants to have milk. He just wants to be he just wants his hunger to be satisfied. Okay, that is called as ID. ID is dependent on the pleasure principle. It is impulse ridden. Okay, it is impulse ridden. What is impulse ridden? Impulse ridden means something that is driven by impulse. Impulse, what does it mean? Impulse means a sudden reaction, without giving a thought. Like for example, somebody just came in front of me and somebody by mistake pushed me, and out of impulse I slapped him. That is called as impulse. Like without giving it a second thought, when you react, it is called as impulse. So ID is based on pleasure principle. It is impulse ridden. It just wants satisfaction and gratification, right? So that is called as ID, which is present in very young children. As the child grows up a little bit, ego comes in. What is ego? Ego matlab? See, Krishna, we cannot say that a particular type of cry is present in a 2-month-old. Okay, the types of cry that we read, no, it is basically situational, and again it depends on the individual. The cry of a 2-month-old is purely a cry that wants its urge to be satisfied. You cannot classify a 2-month-old child's cry into the 4 types that we classified. Okay, it's just a cry that the child lets out in order to have food. That's it. He does not, a 2-month-old child does not even know properly ki mummy yeah. He just wants to be fed. He just wants the hunger to be satiated. That is it. Okay, so when the child grows up a little bit, ego comes into the mind. Now ego this is not that ego like what you have a lot of ego, you have a lot of attitude. No, we're not talking about that ego. When we say ego in the Sigmund Freud's theory, ego means something that gives gives a little management to the ID. When I say management, it means ego is working on the reality principle. Reality principle. Okay, that means it has the capacity to test the reality. Jaise ki, I will give you an example. I have a small baby. When my baby was 1.5 month old, my baby used to cry only when he was hungry. Okay, he did not know whether I am near him or not. Even when I fed my baby and put him down on the bed, even when I moved around the room or left the room also, he did not really mind. He just thought that okay, theek hai, my stomach is full now. Now nothing matters to me. He did not know the reality. He started crying whenever he was hungry. That means there was ID in his mind. Now my baby is around 6 months. Now he knows that the world is outside of hunger also. Now my child knows that I want my mother near me. Okay, now even after my child is fed properly, when I move around or leave the room, he starts crying because he wants me near him. That is ID. Or probably he will be playing with somebody, and when I go near him, he will look at me and start crying and ask me to lift him up. That is ego. So now he is closer to reality. Okay, it is not just about his hunger being satisfied, he is now understanding reality a little more. That is ego. Now, there is one more example that I'll give you so that you will understand ID and ego better. Okay, a very small child will cry as soon as he is hungry. Okay, because that is ID that is governing. When ego starts governing, he is going to cry only when the mother is around, because he knows ki only mother can give me the food. Okay, that is ego. That means ego works on the reality principle. Just understand what is super ego, and then I'm going to give you a very beautiful example that is going to make ID, ego, and super ego very clear to you. What is super ego? Super ego comes when a child grows up into, an adult, and then he has the power of judgment. Okay, he understands that there is something called as society and the rules of the society, and when when a person starts applying the rules of the society to a particular thing, that is called as the super ego. Okay. So there is no particular age that we can say that the ego will develop. As and when the child develops, in some children it might develop when the child is 5 months old or 8 months old or an year. So it is very subjective to an individual. You cannot wait ki, oh, now my child is 5 months old, I think the ego has come in his mind. No, you cannot define it very clearly like that. It develops as the brain of the child develops. Okay, so now currently you have all of these three things in your mind. You have ID, ego, and super ego. Okay, so I will give you a very classic example. Like, for example, though you can say the social rules come into existence when the child becomes 5 years and above, the social rules come into play, though that's again very subjective to a particular individual. Okay. Now, for example, let me give you a very classic this thing to make you understand. You are sitting in a class, like for example, this is not an online class. I am standing on a podium with a blackboard behind me, and you are sitting on benches in front of me. Okay. For example, Ruchira. Okay. So Ruchira is feeling very hungry suddenly. Okay. She is very, very hungry. So what she does, she has a packet of biscuits kept in her bag. Okay, she is very hungry. I am teaching. What she does, she is so hungry that she just pulls out the biscuit packet and she starts eating the biscuit. Okay, what is governing? The ID is governing, because she is just thinking about satisfying her hunger right now. She is not applying any mind there. Here, ma'am is teaching or there are people looking at me. No, she's very hungry. She pulls out the packet of biscuit and she starts eating it. That is ID that is governing. But in case she is very hungry, she thinks the moment ma'am turns her back towards me to write something on the blackboard, I'll just pop one biscuit in my mouth so that ma'am does not see me and it does not look bad. That is ego that is working, because ego tries to manage the ID. Ego tries to think about the reality. Ego does some reasoning. Though ego also believes in satisfying what is needed, but it is working on reality. Okay, so the moment I turn to write something on the blackboard, Ruchira pulls out a biscuit and eats silently, and then I don't come to know. So Ruchira's hunger is satisfied, and even I have not come to know that she ate the biscuit. That means the ego is governing. Now, if Ruchira applies super ego in that situation, what she will say? She will say, no, it is socially unacceptable to eat in an ongoing class. So I am going to wait for the class to end, and then when I go out, I am going to eat the biscuits. That is the super ego or the social rules that are working, and that is called as the super ego that is coming into play. Okay, so that is how the ID, ego, and super ego works. ID is something that does not give a second thought. ID is something that believes in, getting satisfied right now. Okay. Ego is something that applies reality or reason to what is, what is happening. And super ego is something that applies social rules. So are we clear with ID, ego and super ego? Is the example clear? Okay, Kirti. So, what is ID? ID is something that is based on pleasure principle. It wants to be satisfied right now. It does not apply reasoning. It does not think of good or bad, nothing. It wants to be satisfied right now. Okay. Ego is something that wants to be satisfied but works on reality principle. He finds out way, the ego will find out a way to satisfy the ID, but in a way so that it does not get caught, so that it is a little acceptable. And superego is something that brings about the rules of society into play. Okay, that thinks of what is right and what is wrong, and if it is wrong, it does not do it. Okay, that is superego. है ना? तो superego does not believe in satisfying what is needed. It does not believe in it at all. It believes in the social rules. Ego believes in satisfying what is needed, but based on the reality, it finds out a way to satisfy the ID. And ID is very primitive. It wants to do what has to be done right now. Now, so okay, understood. Okay, thank you, Divya. है ना? So a person who has an adult who has ID in his mind, ID that is working in his mind is a person that is not right in the mind. Like you must be going through. Actually, you see news such as the various crimes that are happening, the various killings, the murders, the theft, the rape cases. All of these crimes that happen are the things that happen when a person does not apply his mind, does not apply his ego and superego. The person is angry on somebody, and without giving a thought, he just does something that is very impulse ridden. He just kills somebody or does something very bad to somebody. That is an impulse ridden activity that a person is doing. That is the ID that is coming into play. He has suppressed his ego and superego, and that is why he is able to do something that is socially totally unacceptable. Don't you think a person who does the crime does not know that he'll get caught and will be spending all his life in the prison? He knows that, but he is not able to apply that part of the brain. He just wants to satisfy the anger that he has right now and does something without applying the reality, without applying the social rules. And that is where the ID is working, and that is what that is where the person does something very insanely. Okay. But if a person is able to manage the anger, find out a way to satisfy or calm down the anger by not doing something that is socially unacceptable, that is where he is applying his ego. And if he is able to completely suppress that anger, not have the badle ki bhavna, not have the the feeling of giving it back, that means the super ego is coming into play. So all of these three things. Kirti, is this example okay? Is this example this thing for you, the one that I just told? Okay, so that is how the ego, ID, and superego work. Now, what MCQ can be asked about ego, ID, ego, and superego is, there is a very famous MCQ that says, which amongst the three is the most predominant in an adult mind? Okay, so which among the three positive emotions, as in how? Can you just elaborate your question, Kirti? Which among the three is predominant in an adult brain? So they'll give ID, they'll give ego, they'll give superego, and probably they'll give none or something. Okay, so in an adult brain, out of the three, there is always ego that is predominant. Okay, superego is generally predominant in, no, it's not superego, it's ego that is predominant. Okay, superego is more of a adhyatmic, more of a philosophical part of the mind, you know, because say it or not, you are always trying to, you know, satisfy what you need. Okay, like for example, Shabrani. Okay, Shrabani. Okay, I'm sorry if I got your name wrong. The one who said superego. No, it's ego. Superego is something that is very philosophical. For example, Kirti wanted a more lifelike example, no? So you're walking in a market, you see a beautiful red dress hanging in a, you know, shop, and then what will your ID make you do? Your ID will make you just go inside, you know, go inside the shop, and then just spend whatever you've saved and just buy the dress and come out. And probably the dress was very expensive, but you had such a predominant ID, I want this dress, you spent a fortune to buy that dress, and you just came out. What will ego do? Ego will probably tell you that let's save some more, let's, you know, save for another 2 months so that it does not affect our savings, and then I will buy the dress. That is your ego that is working. And super ego will say that this is all moh maya, this is the, you know, this is not important, you have 4 dresses, why do you need this red dress? You do not need this red dress. That is super ego. Now everybody who said super ego, tell me what is predominant? Isn't it the ego that is predominant? Isn't it always you look for a way to satisfy what you want? Do you always apply the philosophy? Do you behave like a sadhu? No, a sadhu will have a super ego predominant probably, but if you are a general common man, then it will be always ego. You will find out a way to satisfy your needs. You will not bring in philosophy. Okay, so where to mark super ego? This question you have to go for ego only. Okay, if they ask about what part of the mind, or which of these talks about philosophy, which of these talks about super social rules, then you go for super ego, right? Okay. So I hope everybody who said super ego, I hope you are it's clear to you why it is ego and not super ego. Why do we have predominantly ego in our mind? Understood? All right. So moving ahead. Right. Okay. Okay. Yes. So now we come to the psychosexual stages. The third thing that was given by positive emotions like happiness and pleasure, you know. So these emotions are not demanding anything, right? These, when we talk about ID, ego and super ego, who asked me? Kirti. When we are talking about the positive emotions, if they are demanding of anything, then the same rule of ID, ego, and superego is applied. If you want a particular thing for your happiness, then you will find out a way, your ego will work, you'll find out a way to satisfy it. Okay. Don't distinguish ID, ego, and superego as negative or positive. I'm talking about a generalized emotion. You know, in together I'm talking about the positive and negative emotions. There's no separation between positive and negative. You've just gone a little, you've taken a little left turn there, Kirti. Okay, it's all mixed. We're talking about our emotion in total, not separately, right? Okay, clear. So now we come to the psychosexual stages that were given by Sigmund Freud. Right. So he gave basically 6 stages. That is, he said that there is a particular sexual drive that is present in every age, be it an infant or a toddler or a preschooler or an adult or young adult. So there is a particular type of sexual drive to everybody. And he talked about that particular drive or that particular part of the body that he called as the erogenous zone. He talked about an erogenous zone in every stage of life. So he said, he described these stages in around 6 stages. He said there are 6 such stages that are present. 6 stages. Right. Okay. So there are 6 stages. What are the 6 stages? For children, it will be invariably ID always. See, so children as in very small children, like 1 month, 2 month old children, who do not know what is reality. For them, reality is just milk. For them, ID is governing. है ना? As they grow up into probably an year old and all, then reality comes. So the ego will come. Okay. So ID is predominantly present in very small infants, let's say. Clear, Daniel? So we have 6 stages. What are the 6 stages? The first is oral stage. The second one is anal stage. The third one is the urethral stage. The fourth one is the phallic stage. The fifth one is the latency stage. And the sixth one is the genital stage. So these 6 stages were given by Sigmund Freud. Okay. So in the oral stage, he said that oral stage is when the child is of age 0 to 1.5 years. Okay. So here the erogenous zone in focus is the mouth. Okay, let me see if I have pictures for this. There are very less pictures for child psychology. Okay. Yeah, so let me write it down here. Oral stage. So what you all need to remember in this. Okay, so the age is 0 to 1.5 years of age. Okay, the erogenous zone, I will write EO for the EZ for the erogenous zone. Okay, this goes crazy sometimes. Okay. Yes. So the erogenous zone is the mouth. So when I say erogenous zone, that means an area or a part of the body that is bringing about pleasure. Okay, that is bringing about gratification or pleasure. So what is the erogenous zone in a 0 to 1.5-year-old child? It is the mouth. You would have seen 0 to 1.5-year-old child, whatever you give in their hand, they are going to put it in their mouth directly. So it's just put in the mouth directly. That's called as the erogenous zone. So mouth is the erogenous zone. The gratifying activities are nursing, eating, swallowing, sucking, biting. So these are the various activities that give them comfort. If a child is getting bored, that smaller child, if he is getting bored or if he's feeling uncomfortable or insecure, what he'll do? He'll start sucking his thumb, or probably he'll start catching hold of a blanket or something. You need a break. I'm going to give a break at 7:45 exactly. So just bear with me for 10 more minutes, my dear students. And then even I need a break now. Okay, right. So you would have seen that they take everything in their mouth, so that gives them a sense of security, that gives them a sense of gratification. So the erogenous zone is the mouth. Psychosexual means there is some sort of a sexual or gratifying need of every age that is related to the psychology of the child. That is psychosexual. Okay, like for example, in the oral stage, he said the erogenous zone is the mouth. right? So the when the child is allowed to put things in the mouth, when the child is given given the mother's breast or the bottle nipple to suck onto, when the child is hungry, when the child needs security or comfort, when he gets that to suckle on, that is when he develops a strong psychology. When when the child is left hungry or left crying for a very long time, that is when it affects his psychology right from that age. So that is what Sigmund Freud said, that the sexual the sexual desire, or desire to get satisfied is what brings about psychological changes in a person right from the age of 0 to 1.5 years. Okay, now did you get it, Kumkum? So there is an erogenous zone. There is a zone that brings about comfort at a particular age, and that is what develops the psyche of a child, and that is why it is called as psychosexual. Okay, now there is something called as fixation. Fixation means if the child does not get to satisfy his needs through the erogenous zone, the child gets fixed in that particular age. Okay, so what is fixation? If the child is not satisfied on time through its erogenous zone. Kumkum, please tell me, did you understand? On time through its erogenous zone, then the psychology of the child gets fixed at that stage. Right, so the psychology of the child, like for example, if the child is left for a very long time crying and in hunger, then what will happen, he will have a he will get fixed in the oral stage. That means, or in case of insufficient or forceful feeding. So apparently, according to Sigmund Freud, these the symptoms, there will be a sense of insecurity even when such a child grows up. So he will resort to habits such as smoking, nail biting, drinking, talking rudely or sarcastically to people. So an orally fixed individual will grow into such a person who smokes or bites the nails or drinks and talks in bad words. That's called as oral fixation. Fixation नहीं समझ में आया आशीष? मतलब so everybody, I'm going to use a little bit of English again, है ना? So what happens कि एक पर्टिकुलर पार्ट है बॉडी का जो आपको हैप्पीनेस दे रहा है एक पर्टिकुलर एज में, लेकिन अगर आपको अपने डिजायर के हिसाब से वो हैप्पीनेस नहीं मिली उस एज में, तो वो पर्सन जो है वो बड़े होके भी इनसिक्योर हो जाता है. मतलब उसका वो एक इनसिक्योर कैरेक्टरिस्टिक, जैसे अगर एक छोटा सा बच्चा है 2 महीने का, है ना, उसको अगर बहुत लंबे समय तक भूखा छोड़ दें, उसको इनसफिशिएंट फीडिंग करी जाए, मतलब बहुत बार बार भूख लग रही है, उसको टाइम पे फीड नहीं किया जा रहा है, या उसको बार बार फोर्सफुली फीड कर रहे हैं व्हेन ही डज नॉट नीड इट, दैट मीन्स उसका जो ये इरोजेनस जोन है, उसका जो ओरल प्लेजर है, वो उसके लिए प्लेजर है ही नहीं अब, है ना, वो तो उसके लिए टेंशन वाली चीज हो गई. तो ऐसा बच्चा जो है वो बड़े होके भी एक इनसिक्योर अडल्ट में डेवलप हो जाता है ना, उसकी साइकोलॉजी बहुत इनसिक्योरली डेवलप हो जाती है. दैट्स कॉल्ड एज फिक्सेशन. वो ओरल फेज में फिक्स हो गया, है ना, जहां पे ओरल फेज में उसका ओरल एरिया उसको सेटिस्फाई करना था और उसको साइकोलॉजिकली स्ट्रांग बनना था, पर वो ओरल फेज में फिक्स हो गया. तो ऐसा जो इंसान है वो साइकोलॉजिकली insecure होता है, and he resorts to habits such as smoking, nail biting, drinking, etc. That's called as fixation. आया समझ में? Okay, super. ठीक है. So the next stage is anal stage. Okay, or let's say before beginning with the anal stage, let's take a quick break, or should I just फिनिश द एनल स्टेज, 2 मिनट में एनल स्टेज खत्म करते हैं, फिर ब्रेक लेते हैं. डन. ठीक है. Anal stage. So anal stage is when the age of the child is 1.5 to 3 years. है ना? The erogenous zone is the anus, as the name of the stage suggests. And what are the gratifying activities? How does the child derive pleasure from the anus? Because at this age the child develops the control of the sphincters. Till now, he was urinating and defecating without control. He did not have control on the urethral sphincter or the anal sphincter. Now, in this age, he has developed the neuromuscular control on the anal sphincter and the urethral sphincter. Now, he can control the susu. He can control when he wants to go for defecation. Okay, so he derives pleasure by controlling the bowel movements. Okay, so this is the age when you can toilet train the child, when you can teach him. When you want to defecate or urinate, you should not do it just like that. You can tell, because you can control it. Now you can go till the washroom and then do it. So this is where you toilet train the child, and he derives pleasure by controlling the bowel movements. That's the anal stage. Break bus 8 minute. Sarcasm does not have to do anything with the feeding, but because he did not get what he wanted in the oral stage on time, so he becomes very sarcastic. He becomes an agitated, insecure individual. So he becomes sarcastic. He tries to let down people, bring down people. That's why they've written sarcasm. Okay, Khushi is very tired. Okay. Yes, Pawan, it can lead to deleterious habits. Excellent. It does lead to deleterious habits. Okay, so anal stage is that you can toilet train the child. Again, if there is anal fixation, how will the anal fixation be developed? Like for example, if the parents are too lenient, and or the parents are making fun of the child, they do not train the child of toilet training, and they are careless, or the child is not allowed to go to the washroom, like you just do it here only, bhaiya, what do you want, you just do it in the diaper, something like that. So the child does not derive pleasure with withholding the bowel movements, so he gets fixed in the anal stage. And that and an individual who is fixed in the anal stage will be very intolerant to the people who live in an unorderly way. A person who is fixed in the anal stage will almost develop an OCD. Okay. A person who has been handled very ineffectively during the anal stage will have a particular disrespect towards people who are not very ordered or clean, and something like that. They are intolerant. Okay, this is very dicey and confusing. You just remember, a person who is fixed in the anal stage loves to be clean. He likes to be orderly, and he is intolerant to those who are not clean. Okay, so these are all, according to Sigmund Freud, very small psychological variations, they develop because somebody is fixed at some stage from the childhood, है ना? Right now, if I am biting my nails, or probably if I am jealous of somebody, or if I try to make fun of people, or like that, that's some sort of a psychological problem, right? That's not normal. If I'm trying to pull down everybody, talk bad about everybody, that's some sort of a psychological problem. So according to Sigmund Freud, any type of a psychological problem is resulting from an insecurity, and the insecurity is resulting from fixation at a particular stage in the childhood phase. समझ में आया? आई होप समझ में आया, और नहीं आया तो अपन एक बार और रिपीट कर लेंगे, पर अब एक ब्रेक के बाद में. लेट्स टेक अ वेरी क्विक ब्रेक ऑफ 10 minutes. Okay, freshen up. I think you're all very tired, and your psychology has shaken from studying child psychology, but I hope not. I hope the class is going on in an interesting way. I hope you guys are liking it. Okay, so yeah, let's meet after a short break. I think the class will be streamed on the DBMCI app now, and just make sure. And let's meet after a break for the rest of the class. Come back soon.